Let's start slowly, maybe. I'm very pleased to introduce this session, which is so devoted to the role of research infrastructure in European brain health research. We have heard about already a little bit this morning, you know, the importance of this infrastructure. So I'm very pleased to introduce first Sabine Hölter-Koch. In fact, she's replacing, and I thank her a lot, Mara Donofrio. You are not Mara Donofrio, because Mara cannot make it, unfortunately, and Sabine is in fact representing InfraFrontier, you know, the infrastructure for animal models. I think it's a very important aspect that we have also heard about this morning. The other panelist is Jens Habermann from BBMRI, of course, which is also a very important infrastructure. Don't worry, they will all introduce their own infrastructure in a minute. And then the third one is György Vámosi from Euro-BioImaging, infrastructure which also we know very well at EBRAINS because we are very closely related. And myself, Philippe Vernier, I was also introduced this morning. I'm the CEO of EBRAINS, which is the European Digital Infrastructure for Brain Research. And maybe I think I will ask each of you first to introduce in a couple of minutes, 5, 7, 10 minutes, your own infrastructure. And then we will start the discussion between us and also with you, of course. So please, I don't know if the presentation of Sabine is ready, or I don't know who is showing it, by the way. So
maybe if you just click which is.
I think it's here. You think?
If you just go on and see which is the first one.
I don't know where it is. So if somebody can help me with the presentation, I would be really grateful. You. Okay, thank you. So I have not to do anything, so it's perfect. Sorry. So I don't know who will be the first. I see the slides. Yes, so the first one is BBMRI, so it will be your turn, Jens, to present.
Thank you very much, Philippe. And yeah, we thought that some slides might just tell a little bit more than 1,000 words. So I will talk about BBMRI, the European Research Infrastructure for Biobanking and Biomolecular Resources in Health and Life Sciences. And it should be rather more an introduction. But what is also nice to be first presenting, I'm happy to present to you that there are many European Research Infrastructure Consortia, in short ERICs. There are 28 of them at the moment, and you can see them here listed by the cluster from the top energy to the last one, environment. But the largest one is a health and food cluster, as you can see here in the, basically, I'm not sure if this pointer works. Let's see here, basically, and here we have all the three who are presenting today, Euro-BioImaging, InfraFrontier, and BBMRI. So let's switch gears. BBMRI is a distributed health and life science research infrastructure, and we are proud on any of our 20 members and 5 observers. And this is how ERICs are made up. So it's the ministries from the European countries who decide to be a part of such an infrastructure. And we, of course, are very specifically proud of having Hungary also as a member, and Judith Molnar is our national node director here in Hungary. Obviously, the backbone of such a distributed research infrastructure are basically the biobanks and the national nodes. And you can see here on the geographic map that the little orange dots denote each of our biobanks, and they're connected nationally through the national node. And through the national nodes, all the biobanks are connected on the European level. So it's basically 470 biobanks at the moment, plus the affiliated partners at the universities and university clinics, 24 national nodes, plus IAC WHO, and the one headquarter, plus 3 biotech expert centers and expert groups on specific topics in and around biobanking that are the backbone of such a distributed research infrastructure such as BBMRI. You can appreciate that in biobanking you need very specific expertise. It starts from biobank development, technologies, information technology, quality management, ethical, legal, and societal implications. These are the scientific core domains of BBMRI, and then we have more overarching central services and functions such as finance and project management, outreach, education, communication, public affairs, and the central office tries to align all the activities across the infrastructure. Now, if you talk about what a biobank actually is and what BBMRI is about, I would like to just briefly show what the local ecosystem of a biobank is in one of our most dominant biobank types, the hospital-integrated biobanks. So they bridge a structural gap between the clinical care and the research side on the other side, and it's about patient consenting, sample data collection, processing, storage, up to search and biomaterial requests. And the IT infrastructure in such biobanks have become extremely powerful to enable access to samples, clinical follow-up and research data, also biomolecular resources, any kind of omics technologies, for instance, imaging and bioinformatics and AI tools. I'm not saying that each biobank has all these services on hand, but on the local level, national and international level, here we're collaborating with our partner research infrastructure, such as Frontier, Euro-BioImaging, to make basically all the services accessible. And in BBMRI, it's the biobank who is the central access point. If you make this system available also to the clinicians, it can empower patients, citizen engagement, clinical trials, molecular tumor boards. And if this circle is basically functioning locally, it really benefits the clinicians, the patients, and the scientists. And if you do this quality certified and connected internationally, then it becomes extremely powerful. And this is what BBMRI is actually about. So you can see here the life cycle where in the center it's the citizens, patients, and donors who give samples and data to the biobanks or the network of biobanks and national nodes. They, in an aggregated form, make these data and samples accessible through our access and inquiry tools like the directory and federated platform. And you can just appreciate this is now extremely strong. It basically houses 470 biobanks reflecting more than 5 million patients across 32 countries, and even on the federated platform, specific genomes. Now, if a scientist then finds something of interest, we have also an automated matchmaking tool to make the contact between the requester and the individual biobank. And then in the end, basically, what is behind all this data are all the clinical phenotype data, whole slide images, radiology images, connections to national registries, and other types of data, so to say. Very important is that at some point the data need to be brought back into the system, so it can potentially either benefit individual patients in molecular tumor boards, but overarching it enriches the entire system in terms of fair data. Now we support with authorization and the authentication infrastructure with a help desk and LC help desk for projects. We have also training specifically on the LC IT/QM biobank development topics, but also in health and research overarching. Now, just looking very shortly in our directory, we could identify 9 national nodes with about 25 biobanks who have any kind of solid tissue for brain and neurodegenerative diseases available. And this accounts to over or close to 70,000 samples at such. And this is, I think, for many, we didn't retrieve all the identifying data at the moment. So this will be even more. And most importantly, if you consider this wider network, all these 470 biobanks, you can, of course, use this retrospectively, what is already there, but you can also activate it prospectively. And I think this is even more powerful for the future for fit for purpose samples and or data. Now, this has been very strong, the setup, in order to basically structure Europe through relevant EU initiatives in which BBMRI interacts. So it's a cancer mission on one side, pandemic preparedness. We are coordinating the ERIC forum, bringing together all the 28 ERICs, and the chair of the executive board is coming from Euro-BioImaging at the moment. It's Antje Kepler. Then we are also supporting and participating in the European partnerships in personalized medicine and rare diseases. So we might need to discuss also the role of European research infrastructures in the upcoming partnership on brain health. We are also substantially supporting European Open Science Cloud and the European Open European health data space overall. After 10 years of existence, we will build up on our achievements and have, through an unparalleled research infrastructure-wide community co-creation, generated a 10-year roadmap which will help us to increasingly align and scale activities while adopting for One Health approach to tackle the complex interconnected challenges affecting human, animal, and environmental health. I think this is one of the challenges for all of us in the future, by developing climate-friendly operations and advancing global perspectives. And whoever is interested in reading what we are up to in the next decade, please take a screenshot or contact me afterwards. This is also an invitation to stay in contact. So if you're interested, please join us at our annual Congress. We're expecting around 800 biobankers across Europe and the globe to discuss together the next decades to come. Thank you for this, and handing back to Philippe.
So thank you very much, Jens. I think it gives you already a first idea of what research infrastructure is. So you have seen both the interest and also the complexity of the organization, which is, I think, something important to keep in mind. And I think I will hand over to the next. So I think maybe I will skip EBRAINS, because for the sake of time, I've already spoken this morning about this a little bit. So maybe I will just skip EBRAINS because we will have probably the possibility to talk about it later. And maybe I can, yes, hand over to Sabine for InfraFrontier, because I think it's more important than you introduce your own infrastructure before
we can also come back if we still have time.
Yes, we will see. But yes, for the sake of time.
Very generous. I apologize, I'm improvising here. I'm just recycling a set of slides that I used in the past. I'm not an official employee of InfraFrontier, but I'm here as the coordinator of the Predictive Model Systems EBRA cluster, and InfraFrontier is a partner in this cluster, and I've been working together with InfraFrontier for many years. So InfraFrontier is the European research infrastructure for the generation, phenotyping, archiving, and for the distribution of rodent models, meaning mice and rats, and it provides the scientific resource and services to advance research focused on understanding and on treatment of human diseases. It consists today of 21 partners in 15 countries, and it provides this portfolio of services. So it enables the generation of animal models, so any mouse or rat models that you would like to have generated, you could ask InfraFrontier for. If you want these models to be systemically phenotyped, you could also apply to InfraFrontier for a systemic phenotyping project. If you have your own rodent models and want these models to become germ-free, you could apply for the Xenic services of InfraFrontier. And there are also an existing large number of disease models that are stored in the European Mouse Mutant Archive that you could also order, and these, so they wouldn't have to be generated, they would just have to be re-derived and could be sent to you either as embryonic stem cells, no, not as, well, I don't know in detail in which way, but you could derive the tools to breed these mice yourself, or you could order them to receive breeding pairs. And these models are mainly in the disease areas of rare diseases, cancer models, and other specific curated disease models you would all find from the list which you can find under infrafrontier.eu. So anything I'm talking about you could find on the website, and this is also the main contact point for all the services. If you have mouse models that you want to be archived, this can also be done through InfraFrontier. That would then be the European Mouse Mutant Archive. And InfraFrontier also offers training for any part of these services. It helps you in scientific outreach if you would ask for this help. And it is also enabling data sharing, again, everything through this web page. Yeah, and this is the part I'm directly involved in, the systemic phenotyping in the different mouse clinics that are part of the phenotyping services of InfraFrontier. Here you could ask for specific aspects with specific diseases all through the same portal, and you would be guided through InfraFrontier to the relevant mouse clinic that is specialized in your specific disease area. And this would provide you with quality controlled, standardized procedures, also according to the documentation of everything that is being done. And this would include not only providing the phenotyping data, systemic phenotyping data, but also tissue and organ harvesting and archiving could also be part of this. Right, I already talked about the European Mouse Mutant Archive. This is the third largest mouse repository where all the mouse resources are being stored and from where they can be re-derived. This InfraFrontier is in this sense also a distributed infrastructure, both with the archiving and with the phenotyping, and it's more than around 8,700 mouse lines which are available through this European Mouse Mutant Archive. And all of these mouse models are globally shipped, and this is a slide from the beginning of this year. At that time, the numbers were around 500 shipments per year that are being done through the EMA and InfraFrontier resources to about 700 different destinations worldwide. And recently, InfraFrontier also got additional funding from the EU to also develop complementary methods with two new funding calls that were approved, InfraPlus and PRIM Tech 3R. So in the future, there will also be the development of complementary tools where, for example, specific questions might already be answered in mouse ES cells, which could help reduce the number of mice that have to be raised and bred, and thus contributing to the reduction of the use of animals in Europe. Thank you, and this is all I wanted to contribute.
Thank you very much, Sabine. This is extremely interesting. Another very good example of what the infrastructure are good for. And maybe before discussing, I think introduce the third one. And György, maybe you can talk about your own infrastructure, which is... Yes, now it's Euro-BioImaging, so that's your turn.
First of all, thanks to the organizers for giving the opportunity to introduce our infrastructure, which is Euro-BioImaging. This is a distributed pan-European network of imaging core facilities with 19 member states, including EMBL as a member, across 41 nodes, comprising altogether 237 core facilities that offer more than 120 different technologies to academia and industry users. Our part in neuroscience is highlighted by the fact that the largest user group consistently comes from among neuroscientists, which make up about 17% of all users, and on the map you see the geographical distribution of the users at the different nodes. So what does Euro-BioImaging offer to users? There are two main lines. One is the microscopic imaging, where, for example, diverse volume electron microscopy approaches are available, or cross-scale light microscopy from single molecule sensitivity and super resolution up to whole body imaging or whole brain imaging, intravital imaging, microscopy for imaging brain activity in living animals. And these applications range from from basic research up to translational projects studying neurodegenerative diseases and potential treatments. And also the model systems range from cells to organoids up to animals and patient samples. And the other front is biomedical imaging for neuroscience at the preclinical and clinical level, where different MRI techniques are offered to study brain structure, perfusion, metabolism, functional MRI, and magnetoencephalography are good examples. Combinations of different nuclear imaging techniques. Also, new imaging probes are tested at the different facilities, and advanced neuroimage data analysis services, also including AI applications, are discovered and developed. I would like to show just two examples of user accesses. This is an industry user which used the Finnish node to test their software in a real clinical environment at a magnetoencephalography instrument during the diagnosis of the patient. And they were very satisfied with the opportunity, so they asked for a second access at the node. And this is another one where a novel PET radio tracer was tested for norepinephrine. This is also at the Finnish node in collaboration with the Swedish bioimaging node. The Euro-BioImaging nodes strive for making the data fair and help sharing the data with the research community. So, for example, in this paper, all the data, together with full metadata, were made available through the Bioimage archive, made it open access. And I would like to grab the opportunity to introduce the Hungarian activities at the nodes in the field of brain research. So there are two multi-sited nodes, both comprising of 5 and 4 subnodes or facilities respectively. And the majority are in the academia, but there are also two SMEs. One of them is the Femtonics, located here in Budapest, and the other one is in Debrecen's Kalmad Medical. These are distributed in 4 cities. And I'm just listing here some collaborated brain health-related projects with international collaboration, such as the ones running at our university related to Parkinson's disease. One of them is a JPND project where we are involved. Semmelweis University tackles glioblastoma by using uniCAR T cells. The Biological Research Center in Szeged is mainly involved in studies of the blood-brain barrier, and Femtonics is a manufacturer of high-end multiphoton microscopes for neuroscience, but also participates in futuristic, I should say, research projects such as vision restoration for totally blind people in collaboration with the Swiss Institute. And at the University of Pécs, the pharma industry uses the facility to test different approaches to neuroinflammation. And in summary, we can say that Euro-BioImaging is a key stakeholder in this area by providing cutting-edge infrastructure, expertise and collaborations. Neuroscientists are our largest user group, and Euro-BioImaging is aligned with EU priorities. It takes part in JPND, also in transnational access projects like Isidore CanServe, Comulis Globe, and also there is a Hungarian access grant in place called NEM-SKY. And the strategic objectives are to become a critical stakeholder in the upcoming EU-BRAIN health partnership. There are also some challenges, but maybe I will discuss this during the panel session. Thank you for your attention.
So I thank you all three for your presentation. I think it gives you, a very broad array of what the infrastructure can provide. You have seen also that there are obvious connections between them, because you can imagine that you can start from the data existing in the biobank of BBMRI, then making models at InfraFrontier, and then imaging them at BBMRI. So, in fact, I hope that this presentation have convinced you that of the interest of having this kind of research infrastructure, because they are able to put together methods, of course, data, archives, tools, instruments, access to some storage also, and this really avoid the duplication of efforts in between countries or even inside countries, and this is very important. Also, you have seen that most of this infrastructure, if not all, they are built on national nodes, meaning that the national communities are involved. Most of them are co-designed with the community, and it's also a very important aspect for engaging the community into such endeavor. They also, this has been also underlined by all of you, that the data are open access, they are fair, and this is the way the science needs to go, because if we want to be able to use such data, such models, for larger understanding of, for example, the brain, we need to put that together and then to use the powerful method of AI, for example, to develop this. It's also cost effective, as you have seen. This is very important, and also it provides a lot of coordination to the communities, which has been also underlined this morning, and also, which is maybe as important as coordination, is also training, because for most of these techniques or data bank, you need to train not only the new generation of researchers, but also the one which are currently making science, because they are not always aware of this infrastructure, not always aware of the possibility they have. So, and you have also seen that this infrastructure most often they are obliged to have a roadmap, building upon what they have done, but also showing the road to be followed, to increase the interest, the advantages of this infrastructure. And all these roadmaps are included into the European roadmap S3, which will be also renewed this year, and this is also a major aspect of this infrastructure. But, of course, this infrastructure are also facing challenges, and I think it's what we will speak about now between us. And maybe a first question that has been also raised this morning is to see how to better include this resource infrastructure into the overall landscape of brain research, and maybe also beyond brain research, also the overall portfolio of European initiative around health in general. So we have heard this morning that this infrastructure are not known enough, they are not used enough, even if they are progress. So the way of integrating them into this landscape is mandatory, and I will ask each of the panelists to answer this question. I don't know who would like to start first. Sabine?
Thank you very much. I appreciate ladies first, although I'm the least prepared. Yeah, I think for InfraFrontier this is particularly true. I don't know, can I ask for a show of hand who of you in the room knew InfraFrontier? One? I see. Oh, 2. Yeah. Okay. So this is our problem, as I said, so InfraFrontier just became officially a European research infrastructure this year, and it is the infrastructure providing mouse models, and we've seen slides today that the mice are the animal models that are most used, I think my colleagues understand that they need to be more active in the communication space, and now we are on LinkedIn. And for example, you find the most up-to-date information, for example, about InfraPlus and PrimTech 3R on the InfraFrontier LinkedIn page. And all of these endeavors are on top of running the infrastructure, providing the training, interacting with the colleagues. But it's clear that this is the way forward to increase the awareness of the opportunities that these infrastructures can provide.
If I may ask you a specific question, don't you think that even if people don't know InfraFrontiers, they know some of the nodes of InfraFrontiers? I see this at the French level, you know, because the mouse clinic of Strasbourg, for example, is probably much better known than the infrastructure itself. So meaning that, in fact, it's like, you know, there is a, no, I cannot make the joke, it's a French joke. So, but it's using something that you don't know you use, in fact. I think it may also happen.
This is very true. People might know a specific scientist they interact with, they work with, they trust, but they are not aware this person is part of this infrastructure, because the infrastructure is not always at the forefront of the communication.
So Jens?
Yeah, I would agree. I mean, quite often we use infrastructures in different life aspects, so to say. We all came here by train, by plane, by car, whatever. That's infrastructure, right? And we don't even think about that it's there. We just use it. And I think this is the case for the European research infrastructures also. I would think that the knowledge about them might be rather community specific. And I think how these infrastructures started and were developed was mainly by scientists seeing a need to work together and to create something cross-border. And this was, I think, when this ERIC legal entity came alive. But this also shows that I think in our communities where it started, we are very well known. And I think for BBMRI, we have about 10,000 users in the directory. Each year we have basically generated more than 6,500 successful transfer of samples and data within 1 year. We have outreach events with about 25,000 people a year. So there is already substantial momentum. But I think the BBMI started out also in terms of infectious diseases, COVID, cancer research, pediatrics and rare diseases, and then are the other disease domains. So I think in brain health, it might not be so on the plate so far. But what the research infrastructures have developed to is, as the European Commission always says, they are strategic assets. So I think we would be wise in making use of what is already there and expand to specific needs of very distinct scientific communities, rather than starting from scratch, also in terms of resources, but also in terms of accelerating science. Because if I go back in BBMRI, where we started with a preparatory phase 5 years before we were actually approved as an ERIC, and now we are basically 10 years down the road, that's 15 years until you reach such a momentum of making use of such a platform. So if for brain health you will do this and have an outline of 15 years, we might be very late for many, many patients. So I think we should really use what is there, align it, and basically accelerate.
It's a very good point. We can hear about György, about what you think of the same questions. But
so, as I also pointed out in the presentation, the largest share of users comes from neuroscience and brain research already, and all the assets that are requested for participation to make imaging techniques, to use imaging techniques, are already available. However, the visibility could be further improved, and one way would be to provide researchers grants, access grants to these research infrastructures, as we have seen for other areas of science, such as infectious diseases and cancer, through the Isidore project and the cancer projects. But such access grants could be made neutral regarding the topic and available all the time. Because, for example, in bioimaging, capital investments have been made in recent years on the order of billions of euros altogether, and we just need a little grease in the machine or oil in the machine to bring this into even better motion, which is just a fraction of the money which would be spent on these access grants, and to give returns on these capital investments in the form of increased quality of research. So either specific grants, access grants in neuroscience would be very useful, or neutral grants that do not look at what kind of research is done at these infrastructures. And in addition, through their pan-European network, these research infrastructures can contribute to the integration of knowledge and expertise across Europe. And they should also be considered as advisors in policy making, I think.
Yes, I think what you are pointing out here is very important. It's a point I wanted to address anyway, which is how easy is the access to the infrastructure, which means that they need to be better known, of course, and this depends on better advertisement and also outreach activities. But I agree that there is still some difficulty in getting the right cost of these infrastructures. So it's also very different. But if I see infra-frontiers, if you want to have your own mouse model, you have to include this price into the project you are designing. And I think it's something I would like to put forward, that it should be very important and almost necessary now, especially in the European project, to include the cost of the infrastructure into the project, to allow this infrastructure to be run in the right way. Because of course the money needs to come to some places. So I fully agree that I would say access grants is certainly a solution in many instances, but also, you know, the increase of including the infrastructure into the project cost is another very important aspect. And Jens, you wanted to comment on this also.
Yeah, I think bridging basically what was said before, I think it's important to realize that the research infrastructures are really set up generic in order to provide services. And I think this can be used in future initiatives, basically. And the Isidore and CanSurf projects is also another example where I think across the research infrastructures for access, what we did was for disease topic, we created basically virtual core facilities across all the life science infrastructures in the health and life science domain. So a user gets to one portal and gets access to all the services across this. I think currently we have 13 or 15 life science research infrastructures at once. So independent who is managing this infrastructure, independent where the service is located, in which country, at which university. And I think these are two success stories, also specifically provided through funding by the European Commission, where then also through these service provision grants, which is very nice to advertise it to the science community, the services are used and provided. And this budget goes then back to the individual service sites, to the universities, to the university clinics, while the management budget is mainly provided by the contribution by the member states of the ERIC, so to say. And this is a generic model which has now been proven by, I would say, two disease-specific examples, infectious diseases and cancer, but it can be easily rolled out because most of the infrastructures are really set up generic. They're not only focused on one disease. And I think this learning phase should be really taken into account for future endeavors in terms of providing access.
So thank you very much for these comments. I would like to stress one point here. When we were discussing the European partnership on brain health and the use of infrastructure, we made a survey. And one of the main results of this survey was to say that, in fact, not only people are not aware enough of the infrastructure, but they don't know what they provide, and they felt a bit difficult to access to the whole portfolio, which is offered through the infrastructure. So we have proposed through the European partnership to make this kind of entry point, this kind of website in which every infrastructure will be able to be consulted to see what they can offer, to have the full list of services which can be provided in the framework of the brain diseases in that case. But and we felt that there was a kind of a real need for the neuroscience community to have access to these tools, because they will maybe know EBRAINS a bit now, probably Euro-BioImaging, because as you said, imaging technologies for neuroscience are absolutely mandatory. So, but there are many others. Like I don't think that always people think about BBMRI for the data banks, or about infrafrontiers, or I would say also, for example, ECRIN for clinical studies and so on. So, I think such a single entry point for a given community to have access to all the services which can be provided through the infrastructure would be very useful. I don't know, what do you think of this idea? This has been put forward in the framework of the European partnership. It's also human, but...
No, absolutely. And I think this is exactly what is important for the different science communities. So I think if you looked at the infectious disease or COVID in EasyDoor, or for cancer research in cancer, creating one entry point specific mandatory for those communities, it was really in high acceleration of getting aware or raising the awareness and being seen not only in Europe but even globally. And I think this is a really a fast track to basically access services. And what is, of course, there is that all the research infrastructures have their service portfolio on their own websites. But it sometimes seems to be too generic for the scientists to make the link and to find it.
Exactly.
And I think, therefore, this disease-specific one-stop shops basically across all the stakeholders that can engage. And I think it's not only the ERICs, there are a lot of other, also industry, we talked about it.
Yes,
patient engagement, that should be all coming together. But I think the learning curve that we had within the ERICs, that should be taken into account for sure.
Okay, maybe before giving the room the possibility to ask questions, I would like maybe to ask you a last question, which is, for me at least at EBRAINS, a burning questions, which are the main challenge ahead, and for us, one of the main one is clearly the burden of regulation on GDPR, compliant data, which really is something which is preventing us to go further in data sharing. It's really a huge burden. So I think we are making progress in trying to address this issue at the European level, but we are still far from the end. So this is one example, but I would like to know from you if you have other bottlenecks in your infrastructure, which are really important to be overcome to go further in the process of putting all this data and all these tools together.
So maybe I will start. So I would not address GDPR right now, but data handling, that's a very important issue. And bioimaging data are becoming a very valuable asset on the long run. But the increasing volume of the data and the increasing request for computation capacity is a challenge. And Euro-BioImaging approaches this challenge by a global approach. So, for example, there is a so-called founding GIDE, Global Image Data Ecosystem, yes, which is a global initiative. Also, AI holds a very great potential in data analysis, and Euro-BioImaging also has its EU-funded resource to address this issue, which is called AI for Life. So this is on the side of the data, and if I add some more challenges on the level of the individual nodes, that somebody said, I cannot remember whom I should quote now, that to an increasing extent, the execution of science moves to the core facilities.
No, that's very true. We have the same challenge than you. Yes,
and
access.
These core facilities, in some cases, are understaffed. So the institution leaders must be convinced that more staff positions have to be financed, and these people are the most important asset on the long run, sometimes having decades-long experience, and they have to be offered an attractive career path and competitive salaries and moral acknowledgement of their participation.
I cannot more agree with you. I think we at EBRAINS we're also struggling to have an easy access to high-power computing, for example, because we need to go through Euro HPC, for example, which is not always easy to access. So so I would be yes, very happy to join effort with some of you to do so. Because yes, the data storage is also extremely expensive, as you know, and we have also to find a way of be sustainable, because this data, as I would say, it's a gold mine, I think, for Europe and for research in general. So I think also our stakeholders, our policymakers, have to be aware of this, that they need to finance and to support, yes, storage, and also the people who are able to curate the data in the right way, as you said, because this is even more important, yes, I would say. So Jens, I don't know if you would add something to this.
Thank you, Philippe. I think also GDPR is not that issue for us in BBMRI, as most of our biobanks really operating already in the GDPR room, and sensitive health data is the expertise of BBMRI, I would say.
I will contact you then.
Scalability is probably something we need to all look into, and I think there we are having close bounds also with Euro-BioImaging and for Frontier, for instance, also in potentially using AI more also to guide the users to find really what they need of with increasing data capacity, so to say, overarching. I think the challenges are more global for all of us, because I think with the climate crisis that we see, with political instability in the world, I think if I talk to the ministries of our member states, they are rather worried that the economy will not be as stable as it has been in the past. So the research funding will probably decrease overarching. Specifically, we see that already in many national levels, not that strong on the EU level yet, but I think we need to be aware that we need to avoid further fragmentation of the European research area. And I think this is something where we all at the moment do this rather in kind to prevent this fragmentation, and there we need to become more preventive from the beginning if we start new initiatives. And I think we are all in responsibility from the European Commission, from the member states, from the European research infrastructures, but also the science communities, to really think wisely how to invest resources that we have and can afford in the future.
Thank you very much. Sabine, I don't know if you want to add something on it.
Yeah, GDPR is not a problem we have with the mice. Yes. That's not the bottleneck. So, for example, if you have a project where you have a mouse line being phenotyped by infra-frontier partners, there is a grace period where you can have the sole access to this data until you've reached your scientific goal, for example, publication. But in principle, you agree for us to make this data freely available to the scientific community, open access and fair via our data repositories. the problem that you mentioned before, that we need access calls so that the costs for generating these models and for doing the phenotyping and so on are being included into research proposals. This is one of our main bottlenecks. So the presentation I could show you today was one where I was invited to present our infrastructure in a German, from a German funder for ERA-net Neuron, to basically show the scientists that InfraFrontier exists and what the services are. And it was specifically stressed by the funder. And if you would like to use this infrastructure, just write it into your proposal. This is actually doable because this is not standardly known. Yes.
So thank you very much. I have seen that now we talked this with Tim a bit before that this kind of the fact that in the project it's a plus for you to include the infrastructure is now mentioned in several calls, which is good. But this should be probably emphasized again. That's very true.
If I may add one more comment, then this is directed to funders. So the staffing problem could be partly solved if the acquisition grants for instruments would also contain a part for financing staff for a certain period of time. And also the predictability of instrument acquisition grants is a very important issue, that it's not sporadic, but it's continuous.
So thank you very much. Time is flying, and I would like to give the possibility to you to ask some questions. So please, if some of you has other questions. Yes, please, David.
So you made the point that many calls for European funding say you should access infrastructure. But if you're in the know about what infrastructure exists, then you know how to access it. But many people who are applying for these funding calls don't know about it. If someone were applying for a research grant and hadn't done a literature review, you would turn them down immediately. So I think you need to enable it so that applicants can actually access this. And the point someone was making, that a generalized directory may not be that helpful. These need to have tags so that disease-specific or at least organ-specific filters can be used and people can look at it and say what are there. And if those if you like, generic websites, URLs were provided with the calls, it would be very useful for those of us who are making applications. And I think there's some funding, which won't be a lot, from the European Union to create that infrastructure for accessing it would be really helpful.
No, thank you very much for your suggestion and comment. It reminds me that, for example, last week there was the GPND symposium, and there was at least one success story of one of these projects which has shown that by using the infrastructure, which was not intended first, but they had to at some point, it was a major advantage for the project to be successful. And I think we have many success stories like this that should be also put forward to better sell our infrastructure. And as you said, with the probable, at least probably not increase in the future for the funding, as you said, because of the political instability, yes, the possibility of this infrastructure to be better used will be certainly an asset, for sure. I don't know if there is any other questions in the audience. If not, maybe there is still one we have not really addressed, which was also a topic this morning, which is the access from the industry and the SMEs. I think the infrastructure are also very useful for them. I don't know what is your experience with that. Are you contacted?
There are three avenues of collaboration with industry, and one of them is that Euro-BioImaging has an industry board.
Yes, you have shown some example in your slides. Yes.
15 members, so that's one that these are producers of imaging instruments and imaging technologies. and they work together with the nodes to develop and test their new products. The other is that there are especially SMEs that promote or that utilize these capabilities in their own R&D research. And third, there are SMEs also in Budapest, Femtonics, and in Debrecen that are service providers themselves, so they are involved in multiple ways in Euro-BioImaging.
That's very, but I think yes, for both InfraFrontier and BBMRI. BBMRI, for example, are providing samples that the industry cannot access to, and the same for the probably the animal model. So, what is your experience, Jens and Sabine?
Yeah, I think the collaboration with industry is really on different levels for BBMRI. Of course, all the access is open for industry as well. And we have in our directory or federated platform also tick box that basically if specimens or samples and data are only for academics, then you can blend them out. So you can select specifically all the samples data available also for industry, so it makes it easier for them because it's based on the consent, obviously. So industry can be users of our services. On the other side, we also provide specific trainings for SMEs, also in terms of collaboration with E8 Health or within the personalized medicine partnership, so that they know how to interact with our tools, what they can explore, how to explore, and what to access. But there's also another asset to it, which I think brings me also to this avoiding fragmentation or defragmenting, is that we started to co-create with industry. So if we discuss with them and see they have specific needs or we have specific needs, are there certain gaps between academia and industry, why not bridge them together? And I think one part of our federated platform, and maybe this is not aware for everyone here, so it's different technical components of looking on an individual patient level data set and samples. And one of these technological solutions is actually provided by an industry collaborator. So we co-create in our IT ecosystem with industry together and leverage actually also the needs for industry by this. So it accelerates, it uses resources very wisely, and it, I think, a very good way of co-creating together. And then we also, in our annual conference, we have specific workshops together with industry, also to co-create, also towards this, to showcase then success stories of academia industry co-creation and collaboration.
And for you, Sabine, yes, I think it's also probably a bit of the same.
Yes, so I apologize, I cannot answer for InfraFrontier on a general level. All I'm aware of that definitely we've had customers, we've had projects with pharma. For example, these were systemic phenotyping projects, and I'm sure there are also other levels of having them as customers.
So thank you very much. I think we are coming. The best things are always coming to an end. And this is the case of our symposium. So I think you have been convinced now that the infrastructure are not only important, but mandatory for constructing the future European brain data space and brain health partnership. I think it's very important that ourselves as infrastructure we are more probably better collaborating to each other within each other, but also that we embark the community using these very useful tools. Thank you very much for your attention, and I wish you a pleasant lunch.